Let's take you now to the Federal Deputy Chief Medical Officer, Paul Kelly.
About what are the next steps? I'd firstly say that the most important thing is to make sure that we are indeed enforcing the measures that were introduced over the past week. We've seen many changes, and this is continuing to impact on the lives of Australians, and that is an unfortunate component of this, but it's a really important one. If we want to take this virus seriously, and we do want to take it seriously, we need to act now to decrease the rise in cases. This is very important. As things progress over the next few days, there may be further advice and further announcements from government in relation to that advice. But I want to reassure Australians that government is taking the best medical advice, and we are giving that on a daily basis, if not more frequently. So the issues that, just to remind people, is about social distancing and about taking care of yourselves as well as other people. So those issues of social distancing, keeping 1.5 metres apart wherever possible from anyone else, decreasing the number of interactions people have in their daily lives, limitations on outside events, 500 people is the maximum. Inside events, 100 people is the maximum, and then other measures for smaller spaces related to that 4 metres squared rule. Hygiene messages. Washing your hands sounds simple, but doing it properly and doing it often is very important. For people that do have symptoms, if you have symptoms of a cough, a fever, shortness of breath, the symptoms of COVID-19, you should stay at home. That will be the best for your health and also to decrease the transmission of this virus into the community. These are measures that we can all take and should be taking to prevent the further transmission of this virus. So far, of those 1,000 cases, we've seen very few people with severe illness. Only very few people requiring intensive care, and only 7 deaths. Now, that's very unfortunate for those 7 people, but 7 out of 1,000 is very different to where we have seen other countries when they have got to that milestone of cases. This is because we are testing a lot. Over 120,000 tests have been done in Australia. This is one of the highest rates per head of population in the world. We have a very low positivity rate, less than 1%. That is, again, very different to the US, UK, Italy and other places which have reached this unfortunate milestone of 1,000 cases. It demonstrates that we are testing a lot, and we are picking up cases early, getting them to isolate, finding their contacts and getting them to isolate. And this is the way we can get on top of this epidemic. Happy to have questions.
Professor, firstly, on the scenes we saw in Bondi the last 48 hours before the beach was closed, a lot of people who attended the beach reported having no idea about the social distancing requirement, the 1.5 metres. Is that a failure of communication on the part of government? Do we need to step that up? Are you confident that message is getting through, given we have also now seen pubs and other places like that packed over the weekend as well?
So, yes, of course, we can always increase our messaging, and that is very important, and we will continue to do that. I think there is a two-way mechanism for communication. There is the messaging and there is the listening. And I would like to really stress this, particularly to young people. You are not immune from this virus. So whilst we have seen across the world people getting this very severe infection, the 20% or so that do get severe infection are mostly older people. But some young people have also had severe infection. Some young people have died. And some young people have transmitted that infection to their older members of their family. So this is an important message for everybody, including all components of society, to take this message very seriously.
And now Victoria and New South Wales have both flagged this morning that they're interested, when they go to National Cabinet tonight, to take the possibility of just stopping all unnecessary things like pubs and other events or places that people gather, maybe because people aren't following the rules or just as the next step. Is that something that will be discussed in your next health meeting shortly?
So we'll be meeting at from between 2 and 4 o'clock today, the Australian Health Protection Committee and the Communicable Diseases Network of Australia. And yes, we've been asked by the National Cabinet to give them various options about what else to do. I would stress, though, that I think we have a lot that's on the table there. So most of the things you've just mentioned there about limitations for pubs and clubs and so forth are already there. Pubs and clubs need to be taking this seriously. I recognise that the states and territories have powers themselves. The national government also has powers to enforce some of these things. And so we'll be looking at those things very carefully about enforcing the issues that have already been addressed and have already been suggested. I'd give a counterpoint that, that I have seen some really excellent and innovative things happening already in several parts of Australia. I went past a pub the other night and saw that they had hand washing facilities at the entrance. Fantastic thing. I've seen others with signs out there saying we will be limiting the number of people that are coming in, extra spacing of tables in restaurants, for example. These are all very practical things, and it's fantastic to see business as well as individuals taking these messages on board.
And on the rate of testing, you mentioned that Australia has a high rate per head of population. Can you firstly clarify how many individuals have been tested versus how many tests have occurred? And secondly, are you confident, and you mentioned last week that we have to get bang for our buck out of the tests at the moment, are you confident that Australia is doing enough to secure more ways of testing as this virus ramps up?
So certainly we do need to test more. In terms of how many of those 120,000 are actual individuals, I'm sorry I don't have that in front of me, but we have moved in recent weeks to a single test rather than several tests throughout the course of illness. So it would be close to that 120,000. That's a lot of tests. When you think about this virus, it is still quite new. The tests themselves are quite new. We've moved very rapidly in the last month or so to expand testing, and we continue to expand. There are new tests that are on the market, coming onto the market very rapidly, and some of those are more rapid tests. We're looking at those as soon as we can and decreasing any regulatory burden to allow those tests to come in if indeed they demonstrate that they are effective and useful.
Compared to the same time last year, upwards of 25% higher. Obviously, a lot of parents are taking the individual decision to pull their children out of school. As this issue continues, what is the next step for schools? Is this something that seems to be now naturally occurring that the medical advice might change on? Where are we at with schools?
So for schools at the moment, there's no change, but as I said at the beginning, things are moving quickly, and we are aware of that increasing absenteeism. In terms of schools, in my previous times I've spoken about this, I have mentioned that there is much that schools can do and are doing to protect kids and to protect their staff. And so all of those same messages about hygiene, about cough etiquette, about staying at home when sick, about cleaning surfaces, about social distancing. I recognise that these are very difficult, particularly in the younger years of school, but reassuringly there have been very few cases of COVID-19 in children in Australia, similar to where we've seen the rest of the world. And of those cases, almost all of them have been extremely mild.
Pushing to close all schools, and they're going to be doing so alone, even if there's not consensus on a national level from Tuesday. What would be your reaction to that, and is there any downside of closing the schools at this point, and is there a warning for Victoria in this?
So in terms of what different states and territories might be doing, they'll have to talk for themselves in relation to that. I know the Prime Minister is very keen on keeping a federal national approach, but each of the states and territories have their own particular issues that they need to deal with. In Victoria, I understand that their Easter holidays are starting on Friday anyway, so closing on Tuesday wouldn't be a huge change to that.